Hello, I'm Dr. David Beaulieu, and I have more news you can use. Today, I want to talk to you a little bit more, and I know we've done this on a couple of different occasions, Alzheimer's dementia. And the reason for that is that we keep looking at the data, and the data keeps saying we're going to see more and more and more of this disease every year. We've been on a low-fat diet for way too long. The brain is 65% fat by weight. You can't repair the brain on a low-fat diet. It doesn't make any sense. We've created this problem, as far as I'm concerned, at the levels that we're seeing it. And I see the elderly changing very, very slowly, if at all. So we're going to continue to see this problem until the youth change their behavior and we start seeing reduced levels. But in the meantime, there are things that we can change and there are things that we can do. First of all, we know that women are much more susceptible to Alzheimer's than men. In fact, a woman has double the chance of having Alzheimer's at the time of her death than breast cancer. Now, let me say that again. A woman has twice the chance of having Alzheimer's at the time of her death than breast cancer. Now, I did not realize the prevalence of Alzheimer's dementia in the female population of the industrialized world, but it's a serious problem. Anything we can do for that is good. We've already talked about diet, and that's in a previous news you can use. So it's important to go back and look under dementias for articles on Alzheimer's. This, out of the Neurobiology of Aging, a very, very fine journal, and it suggests that people with chronic sleep problems may develop Alzheimer's sooner than those who sleep well. One of the first things that we check, one of the first examinations we do in our office is an examination to determine whether or not the autonomic or automatic nervous system is working properly. And one of the big challenges with the autonomic nervous system is its ability to up and down regulate. Now, it has two different divisions. The sympathetic division, that's the waking division. And the parasympathetic division, that's the eating and sleeping division. That's where healing takes place. Okay? That's where healing takes place. And it's really important at night to be able to shift from the waking dominant state, the sympathetic division, to the resting dominant state, the parasympathetic division. It's at night that the cerebrospinal fluid works to clean up any toxic debris around the brain. It's during sleep that the brain detoxifies. So if you're not getting a good night's sleep, if you're not waking up refreshed, you've got an increased risk. Sleep is really, really important. One of the indications that your autonomic nervous system is not working well is not waking up feeling good. Sleep is critical. Make sure, if you're not sleeping well, you're talking to your physician about helping you attain solid, restful sleep.